Hi, my name is Shavonda Jackson. I am a nursing student from Indiana State University. I will be doing a community health presentation on advanced care planning, preparing for the unexpected. Population at risk. The PAR will include individuals with a low socioeconomic status and have limited resources or limited information or knowledge about this topic. The age group can range from 65 years or older, but with COVID, the age range has varied and it can be anywhere from early adulthood to elderly. Pre and post test. Please take a moment to complete the pre-test before continuing with this presentation. There will also be a post test after the presentation, and there will be a handout for you to view that will give you resources and information about the presentation as well. Thank you. Getting your affairs in order. Advanced care planning. According to Goswami et.al., advanced care planning is a pathway of communication that consists of discussing the specifics of healthcare treatments and care to be received in the future. Also to discuss end-of-life decisions with patients, family members, and caregivers. This alleviates the undue stress and the potential for depression for the family that comes with an end-of-life decision to be made for the patient. This also assures that the patient or individual that their wishes are honored. Advanced care planning is often used for individuals 65 years or older or individuals with severe illnesses. Advance Directive gives an individual the right to create a document that stipulates exactly what healthcare measures are to be taken for an end-of-life decision. This is only carried out if the individual is not cognitively aware of their status or if the person is unconscious. The healthcare measures to be given or withheld include CPR, ventilation, artificial nutrition, artificial hydration, or comfort measures. There are three types of directive, which are the living will, a durable power of attorney, which may be healthcare or financial, and a do not resuscitate order. We will discuss all three in the next few slides. The Self-Determination Act is a law that was legislated in 1990 that mandates healthcare facilities receiving aid from Medicare and Medicaid to ask a patient on admission if they have an advance directive in place. Living will. A living will is a document that dictates the wishes of a patient regarding the type of medical treatment desired if the patient becomes incapacitated or unfit to make medical decisions. The will also dictates what type of life-sustaining measures will be withheld per the patient's request. Those sustaining measures would include the CPR, the artificial nutrition, artificial hydration, or ventilation. Durable power of attorney. The healthcare POA is when a designee will oversee one's healthcare decisions that have been dictated if the person is incapacitated or unfit to speak on their own behalf. The healthcare PA also dictates which measures will be carried out concerning the patient. As in the previous slide, that would be CPR, ventilation, artificial feeding, or IV hydration. Financial POA is when a designee will oversee an individual's financial decisions if the person becomes yet incapacitated or unfit to speak on their own behalf. A do not resuscitate order is an order that an individual has initiated when they have requested not to have CPR or any life-sustaining measures if their heart stops or they stop breathing. Often these do not resuscitation orders are to be taken to other facilities if the patient does dialysis or he goes to other facilities that they would not want this type of resuscitation done. They would also need to obtain an out-of-hospital DNR. The do not resuscitation order is usually acknowledged or recognized in the hospital, but if it's at any other facility, they would have to have an out-of-hospital DNR, and this also can be taken in any rehab or nursing home facilities. Having the conversation. When is the most appropriate time to have the conversation regarding advanced care planning? The conversation should take place in a calm, quiet environment. The approach to the conversation should be presented from an empathetic manner that allows the individual to be open to share their wishes, perhaps with the doctor so they can explain things to the patient to ensure the patient understands the decisions that they're making. Make sure any questions that the patient may have are clearly answered. The earlier that this conversation is had, the better, so the decision making can avoid being made under pressure. So say at the end of the patient's life or during a time where the patient is at the hospital on their deathbed about to die. So if they had this conversation beforehand, then all the patient wishes will be granted at that time. So this is an important conversation to be had with the family to ensure that their parents or grandparents' wishes are honored before they die, so we can do the right things that they will want for themselves, and we wouldn't have to make that decision for them unless it was just absolutely necessary. But it's better to give them the opportunity to make the choice for themselves. These are the references that are available to you. There are also references listed in the handout that will be provided, and there will also be a pretest. This is the end of my presentation. I hope that I have informed you about advanced care planning and advanced directives, and that you have a better understanding of this subject. Thank you.